today we have an Indian male, a young man, 38 years old, who has steadily over the last 5 years developed grade 3 male pattern baldness. He has significant family history of baldness and is likely to progress further. For the last 6 months, he has been noticing that his progression of baldness has been rather rapid. So we propose today to restore his hairline, as you can see in this video, his temple points, and fill up the entire bald area in the mid-scalp. The crown and the remaining vertex will be treated medically. Will be treated medically with DHT blockers for 6 months. After 6 months, since he's 38, we'll try and wean off this medication over a period of 6 months and eventually take him off medicine in the next 1 year. So after hairline design, after temple point design, and taking the approval of the patient, so we are on the same page, we proceed to do the trimming, to clean the scalp with antiseptic solution. The patient is taken into the operation theatre. Local anesthesia is prepared. Patient is placed in the prone position. Marking is done of the entire donor area, the permanent zone of the scalp donor, and the patient is given local anesthesia, which comprises lidocaine with epinephrine. After waiting for about 10 minutes for the ring block to act, harvesting is started in the ratio of 1:5. In our technique, the in vivo preservation technique, we believe that out-of-body ischemia time should be lessened. To decrease the out-of-body ischemia time, we have developed our in vivo preservation technique over the last 12 years. All the grafts are picked only once the entire scalp donor is harvested and not before. This way, the grafts continue to maintain their nutrition from the scalp donor blood supply because they are not completely detached at the base. The punch is cylindrical. The base continues to have blood supply from the scalp vessels and thereby nourishing the grafts, which are picked up once the entire harvesting procedure is over. Once the grafts are picked up, they are put in a nourishing solution which contains, besides PRP, A cell solution and mixture X, which we have over the years developed. It helps in better growth of the grafts after the hair transplant once they are back into the recipient area. And now once all the grafts are taken, we give the patient a break of about 15 to 20 minutes. After this, I proceed to do the anesthesia, the local anesthesia along the hairline, ring block followed by field block using lidocaine with epinephrine. And then I proceed to make the slits using the sapphire blade. The sapphire blade helps in minimizing slit trauma and better results, less telltale signs of surgery, decreasing the chances of a pluggy look, cobblestoning along the hairline, which can occur even with the best of technique in those patients who are prone to develop hypertrophic scarring and even keloid formation. The slits are made in the density of 55 per centimeter square. This, when placed in a particular fashion, closely mimics the density of nature. It is reiterated that the leading 2 or 3 edges of the hairline, the transition zone, should contain only singles, and these single grafts are obtained by carefully dissecting the grafts under high magnification. There is a way of making slits along the temple points, making slits safely without causing any damage to the branch of the facial nerve, which is crucial. The time taken for harvesting 3000 grafts, as in this case, is about 1 hour and 20 minutes. slit making takes about half an hour, and the plantation, which now follows, will take about 1.5 to 2 hours. Once the plantation is complete, the patient rests in the clinic for about an hour before he goes away after we give him the medications for the night, only to return the next morning for a cleanup, adjusting loose grafts, and for removal of all the bandages that were there. So this is the procedure. This is a routine procedure. There is no change in the procedure. All the harvesting, all the slit making, the essential 2 surgical steps of the procedure are done by me, and the remaining is done by a team, which is an efficient team, been with me for last 7 to 10 years. And this is the way we produce natural looking, dense hair transplant results that last for a long time, along with hair loss treatment for men and women. So thank you for watching. If you have any questions about this video, about this case in particular, please drop a message in the comment section below and I'll be there to help you. Have a nice day and God bless you.